So can you talk a little bit about how do you start forming tasters, and what does that mean, and is there a programme? How does that work?
Yeah. I think one of the key things, so we use it initially very much to assess for awareness, and I think one of the key things is framing that for families very much, because the minute you sort of get out a yoghurt, it's very much eating and drinking, and when are they going to eat and drink, and how does that turn into 3 meals a day, and that sort of trajectory of improvement. Whereas sometimes we're just wanting to say, do you know what, we're going to give them some tastes of different things they might like, they might not like, and see if we see a difference in response. So it's very much about framing it and setting it up in that way first. And then I would find out from families, what did they like, what did they hate, did they like or hate Marmite, for example, something that you can dip on the tongue, or yoghurt, different flavours. And I would usually do a session first on my own, actually, so I can see what's happening with the patient and have an idea for myself how well they're responding and how robust and safe their swallow might be for carrying on. And after that, I would bring families in to do joint sessions so that they can see what I mean about what's a voluntary movement versus reflexive, because one of the complicating factors with the swallow is that people can use reflexive behaviours to manage some yoghurt, but actually they're not aware of the bolus, they're not showing any preference for different tastes, but they're managing a little bit reflexively. So then you have to be quite careful about risks versus benefits. If it's not that beneficial, does the risk outweigh carrying on or expanding on what you're giving people? And really having a good idea of why, if you decide to carry on with tastes, why you're doing it and who you're doing it for.